What is public health? When asked this question, the majority of people in America have no idea. This leaves them feeling lost and confused, like they're walking aimlessly through a crowd of people. But actually, public health is all around us. We make decisions to promote public health every day when we choose to eat healthy food, exercise, and get vaccinations. Those are the most obvious ways public health impacts our lives, but there's other ways that people don't always connect with health as well, like voting for a politician, ensuring the environment is clean, and collecting and analyzing data on disease rates in America. Public health is involved with a lot more than we think. To make public health a little easier to understand, let's compare it to the construction of a house. Before construction can even start, a company needs to get materials together to form the foundation and framework to support the whole house. This means they need proper funding to get sturdy supplies that will withstand whatever it needs to endure. In the public health world, this would be funding to promote prevention plans across America. An example of a form of prevention plan would be the California Obesity Prevention Program, which is funded by the Centers for Disease Control and Prevention. Without funding by the CDC, this program would not be able to reach its goals, which include increased fruit and vegetable consumption, increased physical activity, and decreased television viewing and sugar-sweetened drink consumption. Before construction starts, a building also needs contractors and a construction crew to plan and put a building together. In the public health field, this would be the 6 core areas of public health, which include biomedical and behavioral science, epidemiology to study the rates of prevalent diseases, biostatistics to interpret data, environmental health to study the impact of the environment on our health, and health administration, which ensures healthcare is distributed and practiced in the most effective way possible. The next step in building a house is the contractor meeting with the future homeowner to find out what they want and make the blueprints. In public health, the blueprints are the mission. A form of blueprint is made of society's wants and needs and is used as a guideline to make sure that these conditions are met. Once all the planning is done, the construction workers can start to lay the foundation that will support the home. In public health, this support is the substance made up of community activities. The community support of public health is vital because they know the culture and will be able to promote healthier decisions effectively. When the foundation is finished, the framework for the house can begin to be put together. A strong frame for a house is vital because it's the support system for the second or even third floor of the home. In public health, there are 3 levels supported by this framework, and they are the activities by the government, efforts by private and voluntary community groups, and then individual activities. There needs to be effort and support by all in order to keep individuals and America as a nation as healthy as possible. Within the framework is all the nuts and bolts that hold the wood together. In public health, the core functions hold everything together by assessing the public's health, developing policies to establish health, and finally assuring that healthcare is available for everyone across America. An example of this is in the emergency room, and them not being able to turn anyone away. This, however, is starting to become an issue because people come in with severe illnesses that could have been prevented if they had gone to the doctor earlier, but they don't because they can't afford it. It is also one of the reasons why emergency room waiting rooms are always full. There are also things homeowners can do to make their home more efficient, like putting solar panels on the roof to cut down energy costs and consumption. There are 2 new goals to improve public health that are stated in Healthy People 2010, and they are to increase the quality and quantity of life, as well as eliminating health disparities, also known as gaps in the healthcare due to racial, ethnic, and economic differences. As you can see, getting sturdy materials can make a home last a lifetime. This is the same goal that public health in America is trying to reach. If everyone took proactive steps to prevent disease from occurring, then our nation would be less likely to need open heart surgery later, which would cut our rising healthcare costs drastically.